Now, here's the first question. This is more just a warm up, but I want you to think about which phase from when we order a test to when we finally get to communicate those results back to the patient or the customer. So there's all these different components in how we go from A to Z, right? And which of these areas do you think has the most risk for constraints? Constraints meaning this is the area that's slowing us down the most. Now, the lab has a lot of different touch points, does it not? We do a lot of things in the lab, and there's a lot of activities happening outside of the lab to get the specimen to us. And then there continues to be activities after we get the results back to the patient and how things are going. And so the answer to that question is really the phase or the area where we have the most cross-functional human interaction. And what I mean by that is as you look at the pre-analytic phase and the analytic phase and the post-analytic phase, we're in a world where there's a lot of crossover. In order for us to truly impact turnaround time, we have to understand all parties that are involved in getting the orders placed, collecting that specimen, getting it to the lab, receiving it in the lab, and then going through the entire analytic phase of getting to that result and then reporting it out. And so as you think about your own unique processes, whether we're in clinical pathology or anatomic pathology, how many people are touching that specimen, and how many of those people don't in fact report to the lab or report to different functioning units? So it can be quite complicated. And we're going to do a poll real fast, but I want to walk through this quickly. Now, in each of these phases, we have on the slide, let me get out. Do I have a pointer? I don't have a pointer. Okay, I'm going to try to draw. So we have over here the swim lane diagram, each of the areas where the lab is going to interact with at some point or rely on each of these areas to get the job done. And then we have all of our phases up top here as to what's going on with the specimen to get to that result. And don't pay attention necessarily to the little boxes in the process map below, but rather I want to call attention to the 7 practices I've highlighted here that are known bottlenecks in turnaround time. Now, these 7 steps are first with ordering practices, and I label this the stat nightmare because a lot of clients in the past have shared with me the excessive use of stat ordering. And the common theme I hear is that if everything's stat, then nothing is stat, right? But it goes far beyond stat. We have challenges with just ordering the right tests and making sure that we're not ordering excessively. And that moves into our collection practices. Anything from the art of being able to get the specimen to the right container and then get that container or vial or whatever the collection device is to the lab through the courier practice. And then from the courier, making sure we don't lose the specimen, making sure that it gets to the appropriate party, that it's pushed to an individual and received, and then processed in the lab by the appropriate lab personnel that can then take it to the testing practices and then our reporting practices, getting back to the physician. And then the physician has the task, or the appropriate party has the task of communicating those results and interpreting those results back to the patient.